Welcome back to Living Local. In the United States, nearly 39 million people, amounting to 12% of the population, experience migraines. Up to 28% of teens and 1 out of every 10 all school-age children between the ages of 15 and 19 live with migraines, and 37% of children find that their schoolwork suffers during a migraine. Since the onset of the pandemic, record numbers of Americans are working and learning from home, which means more screen time and more headaches. Joining us via Zoom today is Dr. Jennifer McVige with Dent Neurologic Institute in Buffalo, New York, to talk to us more about headaches and migraines. Dr. McVige, thank you so much for joining us.
Thank you for having me.
Let's start here with kind of an obvious but a question that a lot of people don't really know. If you have, your head hurts, you feel like you have a bad headache, how do you know when you have a bad headache and when you have a migraine?
That's a great question that many of my patients ask. Migraine is defined by light sensitivity, sound sensitivity, nausea. It's a moderate to severe headache, and oftentimes people have to rest during it, whereas a regular headache caused by just pressure in the environment or other things is more mild and usually doesn't put you down.
Okay, and now we talked about screen time here when we started this. Can you talk about the link between screen time and headaches and migraines and what people can do about that?
So nowadays our teenagers and adolescents are doing hybrid classes. They're on the computer, on the iPhone, on any device, much longer than I think we have ever been. Many of the things associated with the computer can cause migraines. So the brightness of the computer, so someone can turn the backlighting down, so you have the ability to turn the brightness down. Also, people can wear blue light glasses, which is what I have. It adds to taking down that reflection or that brightness factor as well. Also with kids, limiting screen time and doing some breaks every now and then, so getting up and walking around. Also, people not only are affected by the brightness of the computer, but also their shoulders. And so I always encourage my kids to not have what I call a turtle pose, but rather a giraffe pose, so that their shoulders are rotated back and they're not hunched forward for too long.
Yeah, slouching I think is a thing. Yeah, I have to remind myself a lot too, not to slouch in front of the computer. Yes, absolutely, sit up more. Yeah, the blue light glasses too, also something important. Now, Dr. McVige, now if you've got a teen who you want to help them identify triggers of migraines, how can they do that?
Some of the common triggers are not getting enough sleep or getting too much sleep during the day, taking naps, also not hydrating enough. Also, like I said, this posture kind of thing, this hunched over posture that unfortunately we all are doing now. We just need to rotate our shoulders back and open up our chest wall and sit a little higher. The other things that can be triggers are things in the environment, such as weather, pressure changes. Foods can be triggers, such as nitrates, lunch meat, pepperoni, hot dogs, also MSG, anything that's processed. So trying to stay away from those types of things are really important.
Okay, yeah, a lot of triggers then, so a lot of things you've got to be careful about. Now, you've got a device to tell us about here today called the Narivio. First, we're talking about the Narivia Wearable. What is that?
Well, this is, Narivio is the first drug-free therapy FDA cleared for the acute treatment of migraine in adolescents. It's already been cleared in adults, so adults can use it as well. But it's nice to have something for teens and adolescents that we can use. It's a smartphone-controlled device. It's worn inconspicuously on the arm. You put it underneath your clothing, it connects to your smartphone, and it uses a neuromodulation technique that is neuromodulating basically our body's own native pain system, and so it kind of downgrades the pain that we're feeling regarding the migraine. And the studies have shown that it has been quite effective in causing pain freedom and pain relief in adolescents especially, without having all of the extra side effects of taking drug therapy that you might have.
Yeah, side effects are unfortunately kind of a nasty thing that a lot of people get stuck with in these types of conditions. Now, Dr. McVige, if you wear this Narivio on your arm, what do you feel when you wear it? What is the sensation like, or do you notice it at all?
Yeah, it's kind of a tingle or a vibration. It just feels a little tickly or tingly underneath there, but not bothersome. And you program it to your own native comfort level. So the nice thing is it's programmed for the patient or for the person, and they would turn it on with their smartphone, and then it's already pre-programmed before you actually have the headache. So you just put it on underneath your clothes and go about your business for 45 minutes, and then you take it off and you're done.
Oh, okay, so you don't even need to wear it that long. That's some
No.
excellent news then, too. Now, if somebody wants to try out the Narivio to help alleviate their migraines, how do they get it? Do you need a prescription, or, where do you buy it?
So it's covered by most commercial insurances, which is wonderful. And if they just go to Narivio, www.narivio.com, it's Nerivio. Or if you talk to your doctor, they will be able to look it up for you as well. Most headache specialists will know about this, but if you want to go online and look it up and look at the process of communicating with your physician if they're unaware, that's also a helpful website for you to use.
Okay, yeah, probably welcome news, I would assume, for a lot of people who suffer from migraines on a daily basis. Dr. Jennifer McVige from Dent Neurologic Institute in Buffalo, New York, thank you so much for joining us today, Dr. McVige.
Thank you for having me.
All right, if you would like more information about the Narivio that we've been talking about, just head over to the website on your screen, too. We'll also have those details posted on our website as well at ourquadcities.com.